My name's Dr. Jayant Vanjari and I'm a consultant radiologist at Kingsmill Hospital, Sutton-in-Ashfield, Nottinghamshire. There are many benefits to CT scanning. It can give you a timely diagnosis for patients who are critically ill, allowing urgent surgery or urgent treatments. It means we don't do unnecessary procedures, so we don't do negative laparotomies. We don't send patients to theatre unnecessarily, which is really important. It can reassure patients who might be very worried about a certain diagnosis and can help clinicians make decisions on discharging patients, freeing up beds, and that kind of thing. CT scans involve exposing patients to ionizing radiation. Now that's not a good thing, and we know that high doses of ionizing radiation are harmful to health. The exact risk from a CT scan is really difficult to work out because most of the data we have has been extrapolated from studying people who have been victims of nuclear bombs, and the doses we are looking at are much, much lower than that. But there's likely to be a small but actual risk to the patient which increases with the number of exposures and lots of other factors, such as the patient's age, the patient's sex, and the patient's weight. Many studies show that the doctor's understanding of radiation risk is poor, and some clinicians are not certain which modalities involve ionizing radiation and which modalities don't. The awareness of the consequences of exposure to ionizing radiation is important because in the longer term, this can lead to patients developing malignancies, potentially years down the line. We know that younger patients are more sensitive to ionizing radiation and have got longer to develop malignancies. Also, certain tissues such as breast tissue and thyroid tissue is more sensitive to radiation than others, and female patients as well. I'd like to introduce Pete Thurley, a radiologist at the Royal Derby Hospital, to tell us about a study on CT scan use and age.
When we examined the rate of CT scan use amongst patients at Royal Derby Hospital, there was a rapid increase from the age of 15 to the age of 19, where there was almost a trebling of the use of CT. This isn't really likely to be due to changes in pathology, but more due to clinician behaviour, with adult physicians much more readily reaching for a CT request form. This is important because these patients are still young and therefore are relatively susceptible to the effects of radiation compared to an older population. Paediatricians use lots of different imaging techniques when investigating their patients. I'm sure there are imaging strategies that the paediatricians have that the adult physicians could learn from.
My name's Dr. Richard Bowker. I'm a consultant paediatrician. I probably had some training in radiation dose at medical school, but more importantly, talking to consultant radiologists and paediatric radiologists is where I get most of my knowledge from. When I consider a CT scan for a diagnostic test, I need to know, am I going to get the information from that test that is going to help me manage the case? First of all, I would ask my radiology colleague, is this the right test? Am I asking the right question or getting the right answer from this test? If the answer is that it can be achieved through something less invasive, such as an ultrasound scan or a plain X-ray, then that's really helpful to have had that conversation. Next, I would weigh up whether I really needed to know the information in the first place, or could just watch and wait be another appropriate way of managing the patient. Finally, if I'm going to undertake an invasive procedure, I'd probably involve the parents and the young person in that discussion. They have an understanding of risk just as I do, and involving them and getting consent from them is important in my mind. I know that adult care has hugely different challenges compared to paediatric medicine, but here's a strategy that can cross the specialties. When considering a test, just stop and think, what information are you trying to get? What positive benefits will you have from doing an invasive test in terms of leading management further forward? Have you discussed the risks with the patient? Have you discussed the information that you'll gain from the person interpreting the test, such as the radiologist? Is there a way of getting the same information in a less invasive manner?
Of course, there's a risk in not imaging a patient because an important diagnosis could be missed, and sometimes patients who are very anxious may prefer the certainty of the CT scan result, regardless of any radiation involved. These are complex issues. Therefore, as clinicians, it's important we understand the risks and benefits of performing investigations on our patients and are aware of the different options available to us.